Hey guys, I'm here today with Dr. Emily Pace at East Tennessee Spine and Sport, and she's going to be telling us a little bit more about something that is near and dear to me, and I know to several of my clients and those who follow me here on social media, about pelvic floor health. So Emily, tell us a little bit about yourself and how you got started.
I have been a pelvic floor therapist really since I graduated PT school, which was back in 2011. I have worked with East Tennessee Spine and Sport. We've built a really great program. There's now 3 of us within the company, which is wonderful. And my passion for pelvic health really started just when I started figuring out that we treat this stuff, and it just makes such a big difference in people's lives. And I really just love to help people. And that's why I got into PT, but I didn't realize how much you can really help people until you fix their pelvic floor problems.
Yeah, that's so true. So why would you say was your main reason on wanting to focus on pelvic floor specifically?
Well, there just aren't enough of us who treat this.
Yeah.
There's a handful in the Knoxville community, and it's definitely growing. It has grown so much since I started treating pelvic health, it feels like a million years ago.
Yeah.
But there's so many people who have a need. Everyone has a pelvic floor, and so everybody should have access to someone who can help them take care of it appropriately.
Yes, that's awesome, and there's not enough information about it, so that's one reason we're doing this video today.
Yeah.
So what are some common misconceptions about the pelvic floor in general?
Probably the biggest one is that every pelvic floor is weak.
Okay.
If you're having leakage, if you're having issues in the pelvic floor area, it's weak and you should just do Kegels. And that's usually not the case. The pelvic floor is kind of like Goldilocks. Can't be too tight because then that will be painful, but can't be too weak because then you're going to have issues kind of on the other spectrum. So it just has to be just right. And if it's not, then you can have leakage problems, you can have pain, you can have tailbone issues, you can have abdominal problems, bowel problems, bladder problems, pain with intercourse, like all sorts of things that most people are like, how the heck does a PT treat that?
Yeah, and we don't really hear about a lot of all of those. We hear about a few, but we don't really realize how just the strength of that and working on that area strengthens so many other things in our body.
Absolutely.
Why do you think some of those misconceptions are happening or have happened?
Well, part of where we live, we're in the South, and that we don't talk about that area. We don't talk about our pelvic area at all. It's getting better. People are talking about it more.
Yeah.
But a lot of times people are just embarrassed, and it is awkward. It is a little bit, sometimes can feel invasive, some of the questions that have to be asked, because it is something that as a society we just don't discuss.
Right.
Unless you're friends with me, and then my Facebook can totally come with a warning.
Perfect.
So.
I love that. Yes, you need to go follow Emily and see all of the amazing things that she's posting. Okay, so you named some of the things that are common, and we're familiar with some of them, but what are some, let's get a little bit more into some of the ones that we may not be familiar with, so like bowels and all those, a few of those other ones that you mentioned beside like incontinence, which we're probably most familiar with.
Absolutely. So the pelvic floor has 5 different functions. It helps with support for the pelvic organs. Actually, I have a demo to show you my pelvis.
Yes.
So pelvic floor is a group of muscles that lives between your pubic bone, which is here in the front, so your bladder sits right behind here, and your tailbone, which is right here in the very back. So they support the pelvis as a whole. They support all of your organs from below. They keep you from losing urine and stool when they're working appropriately. They should be able to relax to allow for intercourse and sexual appreciation. And then they should also act kind of as a sump pump, like in your basement. Helps to push all that extra fluid from the pelvic area up into the abdominal area.
Wow.
So a lot of people with tailbone injuries think, oh, I hurt my tailbone, there's nothing I can do about it. That's absolutely not true. There's a lot of things that we can do about it. Tailbone's a joint like anything else, and then you have muscles that attach to it, just like any other joint. And so if there's something going on here, a lot of times there's problems in the pelvic floor, problems with the joint, and potentially problems further up. So a really well-trained pelvic health therapist can assess for what's driving your pain and make a change to it.
Yeah.
In terms of bowel problems, fecal incontinence is something that people really don't talk about. If we're not going to talk about our bladder leakage, we're not going to talk about our bowel leakage. But it happens a lot more than I think people are willing to admit or realize.
Okay.
And so leakage there is never normal, just like leakage from the bladder is never normal.
Okay.
And that can be addressed too. That's really common postpartum, especially if you've had a really significant tearing.
Yeah.
Because some of those tears can go down into
Right.
the sphincters.
Right.
So that can impact those muscles and the sphincter function.
Wow. This is very extensive and many things. And just like as trainers, we know that if you have, an acre of pain in one area, it may be related to something in a completely other area that's attached to it.
Absolutely.
So same thing. Are postnatal women the only ones that are at risk for some of these problems?
No, absolutely not. Everyone has a pelvic floor. I treat patients as young as, I've seen some younger kids. I don't do that very often. There are people who specialize in just treating children.
Okay.
And their continence issues.
Okay.
I tend to focus on, I'll work with teenage girls, I'll work with new moms, pregnancy, postpartum, postmenopausal. I treat the whole spectrum.
Okay.
So there isn't a right or wrong age to have pelvic floor problems.
Okay, so it could, in any of us may need
yeah.
this. Okay.
And men too.
Okay, I was getting ready to ask, do you see men?
Yes, that's a really underserved population. Typically with men, because their pelvic floor is a little bit more, just the way the pelvis is built, it's a little more stable. So unless they've had some sort of surgery or trauma, they generally don't have leakage problems.
Okay.
Not to say it's impossible, but it's much less likely.
Okay.
But if they've had a prostatectomy, where the prostate's been removed, then that can lead to pretty significant leakage for most of those guys. And it's really impactful for them because they go from no problems to really severe problems very quickly.
Yeah.
Whereas with women, a lot of times it's a gradual thing and you just kind of learn to get used to it.
Right.
And you just brush it off and say it's okay, it'll be all right, this will get better, or this is normal, or the excuses we make to ourselves. But men can have a lot of pain related to pelvic floor as well.
Okay. So men are also someone of demographic that may need physical therapy for pelvic floor as well.
Absolutely.
And that's just, like you said, it's an underserved population, so not enough information and just awareness about that.
Absolutely.
Okay, what can someone start doing today to build stronger pelvic floor? We know, like you said, it's not a one size fits all. You can't just go home and do some Kegels.
Yeah.
So what are some just things to be aware of as we're learning more information about this, just as a whole, especially like in the fitness industry?
Yeah.
What would be some general knowledge that you would want to share with anyone?
Absolutely. A lot of times when we think about the core or when we think about the pelvic floor, we think more is better. We're going to lock all of this down and hold it really tight, and that's going to let me do this movement that I want to do without a problem. And sometimes I can actually make those muscles short and tight. So like I said, these muscles are Goldilocks, so they have to be just right. So being able to find those muscles appropriately, being able to contract just a little bit. These are not huge muscles.
Yeah.
And being able to then relax them when you're done. So it doesn't matter if you have the strongest muscle in the whole wide world. If you're clenched here all the time, they're not working for you. Okay. They're not giving you any support or any help, and that can lead to some other issues down the road as well.
We could be creating issues from doing too much. And like you said, Goldilocks, so not everybody is the same. Everyone's pelvic floor is completely different.
Absolutely.
Is it ever too late to seek help from a pelvic floor physical therapist?
No, absolutely not. I have treated patients who they had problems since their kids were babies, postpartum issues, and I don't see them until they're postmenopausal.
Wow.
And that's really heartbreaking that no one has been able to say, hey, I want you to go see a pelvic floor therapist.
Yes.
Because a lot of times these patients do really well really quickly, especially if you're having pain. If you're having pelvic pain, pelvic floor therapist is going to be your best friend, because if we're not the one, if we don't think it's something we can do, we're going to help get you that next step.
Yeah.
We're not going to keep beating our heads against the wall and not making progress. We're going to get you to that next step and get you the help you need.
That's awesome. So I kind of want to circle back around. I have a couple more questions, but I have so many clients and women that I know that, after babies and things like that, what would you say to them as far as encouragement if they think, oh, well, you use the term making excuses for ourselves. That's just normal. That's just part of it. I've had a baby, it's normal to pee when I sneeze or when I, laugh or things like that. So what would you say to encourage them that to seek help?
Yeah.
And that it's not something that they have to live with?
Absolutely. It's a very common condition to have leakage, especially postpartum, but is never ever normal. So what I would say is that it's usually a really easy fix, especially if you catch it early. The longer that you wait to fix these problems, the more time it's going to take to fix them generally. Not always, but for the most part. So it's like if you were to sprain your ankle, right? And you put off treatment for years and years and years, and injuries will just compile on top of each other, on top of each other, on top of each other.
Exactly.
And so if you can hit it at that first time and learn some things to do to address that and make sure that it's not a problem in the long run, you're going to be better off. Pelvic floor is the same way.
Yeah. Hit it head on.
Yeah.
Okay, and just to wrap up, so any sort of pelvic floor issues can be really frustrating and just hard for people, like you said, to talk about. What would you say, again, just as an encouraging thing to, if they're scared, if they've never heard of this before, what would you say just to get them to open up that door and to come, talk to someone or make that phone call and take that first step?
Yeah. We're not scary people, I promise.
They're here to help you.
Yeah, we're absolutely here to help. Any pelvic floor therapist, we do it because we love it. This is not an area that a lot of physical therapists in general are comfortable treating.
Mm-hmm.
So if you're doing this, it's because you want to. And if you want to, it's because you want to help people and get them feeling better.
Yeah.
Nobody should have to live making excuses for their bladder. No one should have to live making excuses for pain. And, even if it's just you're going to make a phone call, you're going to talk to the therapist and see if they're the right fit, that's at least a step in the right direction. Yeah. And not always, but most of the time there's more than one physical therapist that treats this in areas.
Okay.
And so if you have a phone call or you have a first visit with someone and that's not the right fit, keep looking. Find the right fit.
You want to be comfortable.
Absolutely. This is not an area that you want to be really uncomfortable and not comfortable telling your therapist what's going on, because then we don't always know how to help you if we don't have the whole picture.
I love that. That's awesome. All right. Well, thank you for sharing some of your time with me today.
Thank you for having me.
Of course.
Yeah.
Thank you.